Hello everyone and welcome back. So in this video we will discuss the hydrocephalus from CNS. We are having a scenario that there is a 6-month-old infant has a large head and parent says that infant's head looked larger at birth and is increasing in size rapidly. Her OFC is 50 centimeter, weight 4 kg and length 65 centimeter. She cannot hold her neck. So what are the causes, the findings on head and body examination, investigations and management? Another scenario is that parents brought their 1-month-old baby with complaints of increasing head size, and baby was born full term by normal vaginal bleeding with a Apgar score 7 by 10. Mother has history of repeated abortion and head circumference was 42 at age of 1 month. So what is the diagnosis, signs you will look for, investigations, treatment, complications and prognosis of this patient? We are having a definition of hydrocephalus that it is a congenital acquired disorder in which there is an excessive accumulation of CSF within cerebral ventricles. The pathogenesis is that there is increased CSF production, or there is a block in CSF flow, or there is impaired absorption of CSF. These are the causes of hydrocephalus. This is the pathogenesis. Now, the causes are congenital hydrocephalus, that is congenital aqueductal stenosis, or Dandy-Walker malformation, or Arnold-Chiari malformation type 2, or intrauterine infections. Another cause is acquired hydrocephalus. The investigations that are done specifically for hydrocephalus are CT scan or MRI brain, that is, which shows the ventricular dilatation and interstitial edema. The examination of CSF is done for infection and bleeding, and plain X-ray skull is done, which shows the separation of sutures and erosion of posterior clinoids. Okay, so these are the investigation options: CT scan or MRI, examination of CSF, and plain X-ray skull. CT scan or MRI show ventricular dilatation, and CSF is for infection and bleeding. And the plain X-ray shows the separation of sutures, erosion of posterior clinoids. Now, the differential diagnosis of hydrocephalus is that it is chronic hemolytic anemia, that is thalassemia, rickets, and osteogenesis imperfecta, or epiphyseal dysplasia. These are the differential diagnoses. Now, how we will treat the hydrocephalus? Specific treatment is given, surgical treatment is given, and medical treatment is given. In specific treatment, therapy for the underlying condition is done. That is, if the cause is meningitis or brain abscess or brain tumor, then it is corrected. And in surgical interventions, ventriculoperitoneal shunt and between the ventricles and peritoneal cavity is the most effective surgical method. It is created in the ventricles, and hydrocephalus is relief. The medical treatment is to decrease the CSF production in slowly progressive hydrocephalus, include acetazolamide, furosemide, and glycerol. These things are given medically, that is acetazolamide, furosemide, and glycerol, to control the hydrocephalus. So, what are the signs of hydrocephalus? There is that there will be large head, and the infant will look larger at birth, and the size will be increasing rapidly. That is, occipitofrontal circumference will be 50 centimeter, and weight 4 kg and length 65 centimeter. These are abnormal parameters. And another scenario also mentioned that there is complaints of increasing head size, and baby was full term, and Apgar was 7 by 10. Mother has repeated abortion, and head circumference is 42, which is large at age of 1 month. So it is congenital or acquired disorder in which there is an excessive accumulation of CSF within cerebral ventricles, and the pathogenesis is increased CSF production or blocking CSF flow or impaired absorption of CSF. The causes are both congenital and acquired causes. In congenital causes, we are having congenital aqueductal stenosis, Dandy-Walker malformation, Arnold-Chiari malformation, and intrauterine infections. Investigation options are CT scan and MRI, which shows ventricular dilatation, examinations of CSF for infection and bleeding, plain X-ray scan, which shows the separation of sutures, and differential diagnoses are chronic hemolytic anemia, rickets, osteogenesis imperfecta, and epiphyseal dysplasia. The treatment options are specific treatment and surgical treatment and medical treatment. So, in specific, the treatment of the underlying condition is done, which is meningitis, brain abscess, and brain tumor. And the surgical is that ventriculoperitoneal shunt between the ventricles and peritoneal cavity is most effective surgical method. And the medical treatment is to decrease the CSF production, acetozolamide, furosemide, and glycerol. These things are given. In the next video, we will discuss about the cerebral palsy. Thanks for watching.